Hi, I'm Dr. Sarah Smith. I'm a family physician in Edson, Alberta, and I've been in Canada for 5 years, and I've been working as a family physician for around 13 years. I received a comprehensive care plan from one of the local pharmacists who was creating a document with the patient about their complex health needs, and had identified some of the issues that were going on for the patient. But I could tell from the information I received back that they had a lot of trouble trying to understand the complexity of this patient, and that I could have potentially been useful to them if they'd asked me about what was going on with the patient beforehand, and then they could have been more useful in terms of the patient's care and health information as well. I have many patients with complex health needs, and each of those patients is going to different multidiscipline team members, and each of those multidiscipline team members is collecting information from the patient, including things like their medication, their action plans, giving them advice and health information. I, as the family doctor, will receive a report back from each of these people. So as I was saying before, the comprehensive care plan from the pharmacist identifying some actions that might be useful to the patient. And then I've got the primary care nurse seeing them for their diabetes and also working with them on a health goal or some of their health issues. They're going to the diabetic nephropathy prevention clinic, which is providing them with amazing information, and I'm getting a report back from them as well. But this isn't patient-centered and it isn't collaborative. It's not part of a team. Each of these providers is doing a great job. The patient's getting lots of different information. Who has sat down with the patient and identified their goals with them and can collaborate that information and then make it more useful to the multidiscipline team. The care plan is a document that I've created with the patient. So it creates an easy flow document that's got patient language. It includes each of the health conditions, the medications for each condition, who the multidiscipline team members are, and what those goals are that the patient has identified that they would like to work on. Additional to that, I then got the patient's consent to be able to share that with the multidiscipline team members. I then created a letter that would go with the complex care plan to each of the medical providers, so the multidiscipline team, to let them know that this is a document that we've summarized the patient's health issues, and that I would invite them to review it and to give me feedback about whether I'm correct, if we've got all the information that we need, and any other information. And I work with the patient to let them know that this is a fluid document. We're able to change it at any time, and of course their health needs and issues change, and so we need to be able to make this adaptable. The care plan was sent out with the letter to the multidiscipline team, and I've been really excited by what I've got back. At times I'll get a pharmacist writing back with just notes all over the care plan. Perhaps I've missed out on why that medication was started in the first place, or perhaps I've got the medication slightly wrong, such as a recent admission to hospital, or we've just got things slightly changed and the EMR hadn't quite kept up with the actual what's going on for the patient. We've identified some specific tasks for some of the multidiscipline team members to address, and so getting that letter back from the diabetic nephropathy prevention clinic nurses that say, hey, we received your complex care plan, we identified that the patient had this health motivated goal, and so we're working with them on this, and we've actually started addressing that with them. So the feedback's been fantastic. From the patient's perspective, we've had a couple of instances we'd like them to keep their care plan with them, perhaps in their green sleeve. So if they are going to hospital, for instance, that summary is with them. And we've had instances where they've been able to provide that document to the carers, and the feedback back, so I'll get a phone call, hey, your patient's in hospital, and we may have been able to prevent an admission for that patient, and the provider in the hospital's identified that they've got a working family physician and a multidiscipline team behind them, and their health needs are being addressed, and we're able to address that issue. So the patients are excited and happy as well. family physician is really busy, and the last thing we want is more paperwork. The care plan, however, has been a really interesting process. I've been a family physician for a long time, but I've actually found significant satisfaction with doing these care plans. What's made the big difference is that motivational health interview with the patient. The patient's identifying the goals for their health needs that they're really interested in working on, and I make it real. I say, what do you want to work on this year with your health? Make it easy for them to identify what is it that they're actually motivated to achieve. And then if we can use this comprehensive document, the care plan, to be able to forward to the multidiscipline team, you're actually delegating tasks to others. So you're actually identifying to the multidiscipline team member, what is the patient interested in working on, and how could they be of help in that process? You're also asking for information back as the family physician, and you're able to work then with the patient about their health issues and needs. It's been a really satisfying process.